And I think the other thing that is interesting is how can we improve response rates to immunotherapy? Chemotherapy combinations are not tolerable for everyone, and in way too many people, they don't work well. So have you seen any data on combination therapies that make you excited?
Yeah, there was one that really excited me at ASCO this year, and it is a combination of pembrolizumab and another therapy called cabozantinib. And so cabozantinib is what we call a multi-receptor tyrosine kinase inhibitor, so really long name, but basically it targets many different pathways, with one of the major ones being blood vessel formation in the tumor. And so I think what this agent is really trying to do is take away the fuel to the tumor, and by shutting that off, it helps to kill the tumor. And so what this study looked at, and again, it was a small study of about 30 patients, but all patients received both agents, the pembrolizumab and cabozantinib. And I think the data was very impressive. Response rates were pretty high at 45%. And it really seemed to not only help patients in terms of response, but even those who had stable disease or better, that was 90%. And so these are numbers that we don't often see in our clinical trials. And so I think it's, at least in the metastatic setting. So I found it to be exciting. And I think it's going to be a combination that deserves more attention. And there are other agents that target this similar class that are actively being investigated. So, fingers crossed that maybe it will lead to being approved in head and neck cancers in the not too distant future.
Yeah, I thought that data was really interesting too. I mean, it's become pretty clear that for some of our patients, immunotherapy, pembrolizumab or similar drugs by themselves are enough, but for many patients, they aren't. Unfortunately, only about 15% of patients respond to immunotherapy by itself. Are there any other combinations out there that you think are interesting, that you think could potentially move forward and become a more standard part of our care pathway?
Yeah, I think this whole kind of class of cellular therapies and non-redundant immunotherapies, so agents that target the immune system but different from pembrolizumab, for example. I think there's been some negative data, unfortunately, but there's also some exciting, opportunity to build upon harnessing the immune system to work better. And so I do see the potential for some of these therapies to be helpful, but it's still too early at this stage. So more to be seen.
Yeah, I think there's a lot of great questions for clinical trials moving forward.